So hello everyone and welcome back to our webinar series, Next Steps in COVID-19 Response in Long-Term Care and Retirement Homes. In today's webinar, we are pleased to host a discussion in partnership with Health Standards Organization, HSO, regarding the development of the new National Long-Term Care Standards in Canada. I will be moderating this session today from my home office in Ottawa, Ontario. I would like to acknowledge that my home office is situated on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation, and it is an honor for me to be speaking to you from this place today. We are pleased to offer today's webinar in both official languages with French simultaneous interpretation. If you wish to listen to this session in French, then please select French from the interpretation menu at the bottom of your screen. We invite you to use either official language when entering your questions and comments in the chat box. This session will be recorded and a summary will be available to review or share with colleagues who've missed it after the webinar. So as a reminder, the LTC Plus program and webinar series are based on the Reimagining Care for Older Adults report that was published in July 2020. It focuses on 6 promising practices in 6 key areas that have the potential to reduce the risk of future COVID-19 outbreaks or mitigate their effects. We are also pleased to offer this program in partnership with BC Patient Safety Quality Council, New Brunswick Association of Nursing Homes, CADITH, and CMA Foundation. It is now my pleasure to introduce our panel speakers today for today's webinar in partnership with HSO. Dr. Samir Sinha is the Director of Geriatrics at Sinai Health System and the University Health Network in Toronto, and a Professor of Medicine at the University of Toronto and the Director of Health Policy Research at Ryerson University's National Institute on Aging. A Rhodes Scholar, Samir is a highly regarded clinician and international expert in the care for older adults. He was recently appointed to serve as member of the Government of Canada's National Seniors Council and is also leading the development of the new National Long-Term Care Standards in Canada. Professor Alex Mihalidis is the Associate Vice President for International Partnerships at the University of Toronto and the Scientific Director of AgeWell, Networks of Centers of Excellence, which focuses on the development of new technologies and services for older adults. He is a professor in the Department of Occupational Science and Occupational Therapy and in Biomedical Engineering, with a cross-appointment in the Department of Computer Science. Alex received a PhD in Bioengineering Rehabilitation Engineering in 2002 from the University of Strathclyde in Scotland. He has been conducting research in the field of technology to support older adults for the past 17 years, having published over 200 papers and abstracts in this field. He is also very active in the rehabilitation engineering profession as a fellow and past president of the Rehabilitation Engineering and Assistive Technology Society of North America. So I'm over to you, Dr. Sinha.
Perfect. Thank you so much, Tanya. And it's really a great privilege and honor to be here today with Alex. While we're chairing 2 separate committees, we really see each other as co-chairs of this really important work as we move forward together in developing these new national long-term care standards in Canada. So we're both here today, as you heard, to present and to share with you a little bit more about what we're doing, how we're trying to engage, and how you can get involved in this work. So I'll be starting the presentation and Alex will be joining to present as well from the perspective of the work he's leading as the chair of the CSA technical committee. So just go to the next slide. So our agenda for today is really to talk about why are HSO and CSA developing new national long-term care standards? How will new national long-term care standards be developed and what has been done so far? We also want to share with you some of the preliminary findings from HSO's inaugural national survey. This is a survey that's being used to inform the work of both the HSO and CSA committees, and how we want to also share with you how can the public get involved in the development of the new national long-term care standards, and then we'll have plenty of time for a question and answer session as well. Go to the next slide. So who are HSO, CSA Group, and SEC? Often we're in this whole world of acronyms, just like we have HEC for heck as well. But just to give you just some familiarity with this, because people see these terms and they say, wait a minute, is this actually, who are these organizations? And is this kind of along the lines of what the federal government has been talking about, developing of new national long-term care standards? So hopefully this just gives you a sense of the three key organizations that are involved in developing the new national long-term care standards for Canada. So HSO, or otherwise known as Health Standards Organization, they develop standards, assessment programs, and other tools to improve the quality of health services in Canada and globally. And so you'll be familiar with HSO standards if you've been participating in Accreditation Canada's work in hospitals or long-term care homes or in a number of other settings. That's where you'll be very familiar with that name. I think CSA is a very well-known name across Canada. Again, Canadian Standards Association, operating as the CSA Group. It's a not-for-profit member-based standards development organization that develops and maintains codes and standards in several areas that meet the needs of a broad array of industries and stakeholders. And then both HSO and CSA Group are recognized standard development organizations. And who are these recognized by? Well, they're recognized by a federal crown agency called the Standards Council of Canada. So it's a corporation that leads and facilitates the development and the use of national and international standards and accreditation services in Canada. So any of us who want to start developing standards, well, we can do whatever we want to do, but if we want them to be recognized as a national standard in Canada, for example, then they have to be recognized as standards development organizations by the Standards Council of Canada, follow its processes, and adhere to its own standards as well. So go to the next slide. So what are standards and how are they developed? Because people hear about standards and then the question is, what exactly are standards? So it's one of these things is we often don't think about standards until we're asked to think about them. And standards really exist in every aspect of Canadian life. So in fact, we call them the invisible infrastructure that allows us to live and work safely and thrive. And they can become the basis, when we develop standards in Canada, they can become the basis of government legislation or policy, regulation, and including accreditation standards. So the development of HSO standards is overseen by the standards technical committees, and standards also go through a public review process in which stakeholders and the public can provide feedback. The CSA Group, similarly, is a leader in standards research, development, education, and advocacy. Their technical and management standards developed with their 10,000 members improve safety, health, the environment, and economic efficiency in Canada and beyond. So HSO and CSA, as I mentioned earlier, both recognized by the SEC as standards development organizations. We'll go to the next slide. So why are HSO and CSA developing new national long-term care standards? So I don't think it's any surprise for folks to know these stats, but the COVID-19 pandemic has certainly highlighted the gaps and needs in Canada's long-term care system. To date, 58% of all Canadian COVID-19 related deaths, or over 15,000, including 30 staff deaths, have occurred in long-term care and retirement homes across Canada. So HSO and CSA Group submitted proposals to the Standards Council of Canada to develop two new complementary national long-term care standards. And SCC accepted the proposal and agreed to fund the development of the new standards over 2021 and 2022. And this was in response to the federal government itself that committed last year in working with the provinces and territories to set new national standards for long-term care. You may have heard the Minister of Health talking about this in the spring of 2020, and then in the September throne speech and subsequent mandate letters to the Ministers of Health and Seniors, there was that statement that the federal government wanted to move forward in developing new national long-term care standards. But again, if the federal government wants to develop new national long-term care standards, standards are not a politically driven process. Standards themselves are well, we'll just hide this slide for a second if we can, the poll, because we'll do the slide after, we'll do the poll afterwards. But what we can do is, so when you're doing a So when a federal government says we want to develop new standards, for example, again, they would then look to their crown agency, which would be, in this case, the Standards Council of Canada, and hence that's to which HSO and CSA stepped up and said that they would be willing to do this. So in budget 2021 as well, the federal government has also committed $3 billion to support the implementation of new long-term care standards when those come into effect and are completed next year. So we have a few polls that were launched, and so I think lots of folks are participating, but I don't know. Okay, so I think we can start the first one here. In this is the first slide that we have, just to get to know. But in your opinion, are long-term care homes in Canada providing safe, reliable, and high-quality care? So if you want to take a moment here, and then we'll get folks to be able to answer this question. So we have about a strong 99% of the group already saying that they believe that homes should be required to meet standards. And we have a pretty kind of an even split between the idea of agreeing or disagreeing about believing that long-term care homes are providing safe, reliable, high quality care. Perfect. Okay. We'll go to the next poll then. And then in this one here, I think people can still vote, or maybe I don't know if we can relaunch, but we can stop it here, I think. So in your opinion, are long-term care homes, so we just stop that. That's perfect. Okay, so I think those were our two questions there. And okay, and then we have another question here that we want to ask folks. What type of home do you represent? If you're involved in a long-term care or retirement or supported living environment or other, can you please let us know? We want to get to know who's in the audience today as well. And then our second question here is, what is the profit status of your home? And for those who are writing in other in terms of who they're representing, for example, it'd be great if you share in the chat kind of what other environments or roles that that you might be playing. But clearly, the majority of people who are involved with us right now are certainly representing kind of the long-term care sector, if you will. But we have a lot of people, about 1 in 5 folks here who have other roles. So we have folks from infection prevention and control, and safety, and we've got a lot of, oh, this is great, thank you, that's great. And we certainly have about 50% of our representatives here are representing kind of not-for-profit homes, but we have a good representation for folks who work in the for-profit and the municipal sector as well. So that's perfect. Okay, so I think we'll end the polling now then. This is great. And this is important because it'll help to also show a little bit of the results that we had in our national survey that we're going to share a little bit later on today as well. Perfect. Okay, so I think we can close the poll now. Okay, I'm going to close the slide if I can. Okay, so then we'll go to the next slide. Okay, so why are HSO and CSA developing new national long-term care standards? Well, HSO and CSA group are working collaboratively, as I mentioned earlier, on developing 2 national standards for long-term care. And some people say, well, why do we need 2, for example? And I think this is, again, recognizing the strengths of these 2 organizations. HSO's National Long-Term Care Services Standard is going to really focus on the care that's delivered within a home, if you will. So to address the delivery of safe, reliable, and high-quality long-term care services, services, whereas CSA is providing a real complementary approach, really playing to their strengths, really focusing on the operation and the infection prevention and control of long-term care homes. And so this is where is the opportunity to address the design, operation, and infection prevention and control practices in long-term care homes. And the way I sometimes kind of explain it to colleagues is that, you know, there's kind of, you think about the software and then you think about the hardware, but obviously there's a lot of overlap too. And that's why Alex and I as co-chairs and both organizations are absolutely committed to working collaboratively throughout this process so that we can make sure that both standards are complementary and supportive of really helping move our long-term care sector forward. We'll go to the next slide. So what are our timelines? Our timelines are one and the same, really. HSO and CSA group have come up with a standard timeline. And sometimes people say, wow, that's going to take a long time to do this. You know, really, you know, can't you just do this in a few months and be done? But the Standards Council of Canada has very strict criteria on how standards are to be created and the timelines over which it needs to occur. And both CSA Group and HSO actually have developed, believe it or not, an accelerated timeline so that we get these launched by the end of 2022. And so the steps really, as we've been going through, are establishing a technical committee. So both HSO and CSA Group launched a call for applications, and each organization has its own respective technical committee or technical subcommittee that's helping to lead the development of this work. Between June and August, there's a lot of work going on to review the literature, understand kind of the landscape about all the great work and research that has actually been done. And that's really helping to inform the standard drafting work that is now well underway by both organizations and their respective committees. Basically, by the time these committees come up with kind of their first draft based on the input that we're getting through our various public engagement processes as well, then the work comes out to what we call a public review process. And that's where basically any member of the public, anybody here on this call, has an opportunity to actually take a look at what's actually been developed and to provide their feedback. And that feedback then is required to then go into a second round of drafting between March and August 22, where both CSA Group and HSO will look at the feedback received from the public, for example, and then be required to make sure that they're looking at that feedback, addressing those comments before the standard is actually finalized. So there's a lot of steps involved here, but again, all well thought out. And again, this is in accordance with what the SEC requires of its overall process. So again, this is a 21-month process. We're already about I'd say time has been flying, so at least 4 to 5 months in, but the work is well underway, and there's still plenty of time for folks who are on this call today, if you're not absolutely as a member of the technical committee, to be engaged in a variety of ways. Go to the next slide. So I'm going to talk a little bit about what the HSO National Long-Term Care Service Standard will focus on a little bit more. And then Alex is going to talk about the CSA standard as well. So HSO standard will focus on the idea of resident and family-centered care practices, safe, reliable, and high-quality care, the idea of a healthy and competent workforce, and an organizational culture that is outcome-focused and strives towards the safety and well-being of all Canadian. And right now, for those of you who are not aware, HSO has an existing national long-term care standard available, and you can look at it on our National Long-Term Care Service, our National Long-Term Care Standards, or actually it's our longtermcarestandards.ca website. We'll put it in the chat so that people can actually see the website, but you can go and take a look at the existing standard. HSO previously developed a standard through a full review like this back in 2012 to 2014. And then between 2018 and 2020, they did an update to that standard as well. But obviously there's an opportunity now to re-examine the standard and look at how it can be improved. And so that's the process that's now officially underway through a full and proper update. We'll go to the next slide, and then Alex will certainly talk about the work that the CSA Group is leading as well. So we'll go to the next slide and then invite Alex to speak.
Great. Thank you, Samir, and thank you to everyone for this opportunity to talk about the standards work. And I really just want to reiterate what Samir has been saying on how close we are working together in the development of these standards. And I do like the analogies, hardware and software, being an engineer myself, and so that's a very good way of describing it. So to complement the standards that HSO is developing, CSA is looking at a new national standard around infection prevention and control, or IPAC, within long-term care homes. And this really includes anything within the infrastructure itself. So anything from safe operating practices, infection prevention control practices, but probably more important is the design of the homes themselves, in order for IPAC really to be something that can be easily implemented, but also to complement the work that the HSO standard is looking at as well. So for example, if the HSO standard talks about, the type of care that needs to be provided, well, our standard needs to ensure that we can provide the infrastructure to support that. And that is why we're looking anything from, cleaning and disinfecting processes, waste removal, heating, ventilation, and air conditioning, plumbing, medical gases, etc. But also looking at things such as, the furniture design, the design of the hallways and the resident rooms, finishings for the furnishings and things like that as well. And the other thing I'll just mention before we move on to the next slide is we, like HSO, is taking very much a resident-centered approach to this. And so we have put together a working group of residents and caregivers who are guiding the work that we're doing, because we always want to keep in mind that we are not developing standards for a healthcare facility here. We are designing standards for the homes of many older people who are living there, and also the staff and caregivers who are working there. So we want to make sure our standard covers off the safety of all those that are involved. Next slide, please. So I'll hand it back to Samir, who'll talk about the fantastic national survey that HSO did.
Perfect. And I just want to reinforce what Alex was just saying, is that, when we were putting together our technical committees and our technical subcommittees, basically we were overwhelmed by the amount of interest that we received, hundreds and hundreds of applications. And again, the Standards Council of Canada is very deliberate in whenever you create a technical subcommittee, for example, or sorry, a technical committee. When you create a technical committee, for example, it can't just be whoever you want it. There needs to be, again, geographical representation. There needs to be a mix of expertise. And in fact, for health-related standards, there is the requirement that 1/4 of the members of the technical committee, no matter how big it is or how small it is, 1/4 have to be residents and family members, if you will. Another quarter have to be frontline workers, or people who work in long-term care homes, if you will. Another third have to be, or another quarter, sorry, have to be what we call policy or decision makers, people who have kind of more that leadership and decision-making kind of authority. And then a quarter of the seats are also reserved for individuals who have, a broad base of expertise, so people who are research or subject matter experts in the area. And so those 4 groups have equal representation on our technical committee, for example, for HSO. And then specifically, whenever we create a subcommittee, there needs to be equal representation amongst those 4 groups in each of the working groups. And so, for example, we have a working group that's focused on those first 3 things we talked about: one about workforce, one about resident-centered care, and then one about safe, reliable care. And so really making sure that we don't lose that voice of who this is all about, our residents and our workers, at the forefront of this work as well. So just wanted to reinforce how we've really appreciated that so many people have come and stepped forward to be members of the technical committee, but also to provide their input as we seek input through surveys, but also through various other engagements that we're going to talk about moving forward for the rest of this talk before we open it up to questions. And a lot of great questions coming through the chat. So we'll hopefully our HEC folks are keeping track so they can pellet Alex and I with these questions after that. So I just want to share now the preliminary findings from HSO's inaugural national survey. This is a survey that actually we had to put these slides together just about a week or two ago for translation, but we just completed that survey on July 31st, and we had over 16,000 people who ended up responding. So this is our pre-final iteration at 15,367 responses. So again, if people are saying, is anybody really interested in this area? People are, and we just want to share with you a little bit about who is responding and kind of what some of the results are, and why we asked you some of the polling questions a little bit earlier in this question as well. So again, the survey was open to anybody across Canada who had an interest and want to complete the survey. And the survey was open between March 31st, when we launched the announcement of the work that HSO and CSA were doing together, and then ended on July 31st. And so the vast majority of respondents were respondents in English, and again, a strong representation from female respondents in particular, but it also recognizes the fact that many of the folks who are participating might be frontline workers, the majority of that workforce being a female-led workforce. The majority of family caregivers tend to be women, for example, and the majority of long-term care residents tend to be women as well. When we asked about people of their what their age was, again, you'll see a variety of people of all ages, for example, responding. So not just older people, but people even within in the 18 to 29, 30 to 34 age group. So lots of people participating from that perspective. We'll go to the next slide. When we asked people where do they live, for example, again, we had representation from across the provinces and territories as well. And while it says Northwest Territories, Yukon, and Nunavut 0%, we actually did have responses that equal their percentage of the population of Canada. So it's small populations, but certainly we did get some great responses in from our territorial partners, and then a good level of response from provinces across the country as well, including Quebec and principally Ontario as well, an outsized level of response as well. We'll go to the next slide. In terms of our total responses itself, again, you'll see people could identify in a number of different ways, and so with that, what people were responding, you can see that many folks who are participating were family members or unpaid caregivers to a long-term care resident. We had 18% who identified themselves as healthcare providers, who are long-term care staff, but we also had people who are not healthcare providers but work in long-term care, including managers and administrators or other roles, for example. We had a number of concerned citizens, and then other folks participating as well. So a real robust response, and really thrilled to get so many family caregivers, but also frontline workers or people who work in long-term care to participate in our survey as well. We'll go to the next slide. And then in terms of just other aspects as well, we were pleased to see that we got some responses from folks who identified as being Métis, Inuit, or First Nations as well. And of course, we had a number of people throughout the survey, you'll see, who chose not to respond and not respond in certain ways. And we heard some feedback for people who did not want to respond, especially in terms of speaking about their role, for example, or where they were from, because a lot of people did not want to be identified in relation to their answers, because there's a lot of people were writing in comments, for example, speaking about just the fear of, like, who's reading this, and could this potentially affect my care, or my role, or my family members' care as well. So certainly we respect that, but we've indicated that as no response. We certainly had a proportion identifying themselves as a visible minority. We certainly had close to 1,000 people identifying themselves as a person with a disability as well. We'll go to the next slide. So when we actually look at the responses that we had, each of these different quadrants here on your slide represent one of the 4 questions that we had, and you'll see some of the same questions that you were asked as well. So the first one was, we asked Canadians, for example, are you aware that existing long-term care standards are currently being used, or that there are existing standards being used in long-term care homes in Canada? About 50% of the respondents said yes, and then another 50% either said no or they didn't have a response to that question. In your opinion, are long-term care homes providing safe, reliable, and high-quality care? So we had about a 50-50 split in our group between those who agree and those who disagree. And in this case, it was interesting that we had a number of people, the largest group responding to the question had no response, if you will. But for those who were providing a response, the majority of folks were saying they disagreed, with this question about homes providing safe, reliable, and high quality care. In our third question, we were asking people, do you think homes should be required to meet standards? So our group today said 99% basically were saying that yes, they should be. And in this group, we had, again, in a similar way, like literally 0% said no, 61% yes, but we had a large percentage that gave no response to that question. And then to question 4, when we ask people, reflecting on your responses, this is our final question: what is the most important issue the National Long-Term Care Services standards ought to address? Folks, again, we're talking about high quality care, safety, workforce, but also the importance of funding, and a lot of people were commenting on the role of ownership as well. So we'll go to the next slide. So again, when we were asking people what is the most important to you when it comes to providing resident and family-centered care practices that value the importance of respect, dignity, and trust and quality of life in long-term care homes, again, what we clearly heard was that these components were all important. People were talking about the need for caring, compassionate, and competent interprofessional care teams. People really talked about the importance of collaboration, communication, critical thinking, creativity, and really about this notion that care and the provision of care must include the resident and family members when it's appropriate. People really talked about the needs to prioritize the rights, the needs, and satisfaction of residents, and thinking about the importance of providing culturally appropriate and safe care, and making sure that it's responsive to the evolving, increasingly complex care needs represented by those living in long-term care homes. And when people often talked about this idea that they wanted to see care that embodied the quality of a home, and so and people were using terms like privacy, comfortable, clean. They want to make sure there's high quality mealtime experiences in that way. And so this is really helpful in helping us get people's responses. And just so you know, I had a very hardworking postdoctoral research fellow who actually went through and read every single one of the 16,000 plus surveys, coded every single response, and it allows us to do subgroup analyses. And this is data that we will be providing, for example, to our colleagues at Indigenous Services Canada and others who are interested in looking at kind of specific populations and their responses, so that we can get more information to help various long-term care strategies as they're developing across the country as well. Go to the next slide. In terms of the next question about what is the most important when it comes to providing safe, reliable, and high quality care in long-term care homes, again, people said that this needs to be the bare minimum. And people talked about the need for equitable care across jurisdictions. They want to make sure there's consistent, accessible, affordable, and culturally appropriate care. People really talked about a culture of care over profit. And people want us to make sure that we're focusing on enhancing living and working conditions. People want to make sure that there is national guidance and support, and that we have attainable minimum standards that reflect the best care practices in care design and technology. And that really, starts speaking to some of the strengths that the CSA group will be bringing to this work as well. And ensuring organizational accountability and transparency and appropriate funding. A lot of people have remarked that you can have the best standards in the world, but if you're not appropriately funding a long-term care system, it's really hard to achieve high quality standards of care. We'll go to the next slide. When we ask people what is most important to you when it comes to maintaining a healthy and competent workforce in long-term care homes, people really talked about, again, things that won't be a surprise: job security, opportunities for full-time employment, and permanent employment that is equitably compensated. People talked about affirming, positive, and supportive work environments, the idea that staff are respected, they're valued, they're empowered, that leadership is present, accountable, and open to feedback, that the workplace health and safety is being prioritized as well, with proper staffing level and ratios, physical resources, and time to provide care, and that there are opportunities to provide regular staff health and wellness checks as well, along with access to support. And those of you familiar with the Long-Term Care Commission of Ontario, one of their big recommendations coming out was that they felt that staff should have access to mental health supports, given the amount of trauma that frontline staff members have been through over the past year, especially with 30 people, frontline staff in long-term care and retirement homes, having died across Canada. And education and competency standards. People talked about the importance of licensing standards and regulation, and opportunities for paid on-the-job mentorship and continuing education. So a lot of really thoughtful comments to really help us think about how do we better empower those who are working and can thrive, because the long-term care workforce is the backbone of a great long-term care system. Go to the next slide. Number 4 really speaks to some of the work that Alex and his team are leading, from CSA. And so that's why we asked this question in the survey, which is, what is the most important when it comes to considering the environment, operations, maintenance of long-term care homes to improve the quality of life? And again, people talked about these things that really matter. HSO, when it develops its standards, doesn't really talk about these aspects. They talk again about the software or the care, but all these other things are really important when we are thinking about achieving this. And this is everything from people commenting about air, light, and sound quality, talking about the types of buildings that they felt that should be considered, private rooms, accessible and aesthetically pleasing spaces, thinking about safety and security, everything from fire safety, and striving for high standards of cleanliness and maintenance that come to the operational aspects of a home, for example. And again, a lot of work that people might think, no, is that really what we care about? It's absolutely essential. And this is the great work that, again, the CSA team has been leading in particular around. Go to the next slide. So again, I'll speak just briefly about what HSO is doing in terms of continuing the engagement. So that was the first survey that, again, had over 16,000 Canadians participate in. So first of all, if any of you participated in that survey, thank you. I like, people always say, well, why am I filling out a survey? Who's reading this? And is someone actually reading this? No, it's absolutely important. These were the results that, as they were flowing in, were being fed to our technical committee. It actually then allowed, and it's actually been helping the technical committee inform its work to make sure that it understands kind of what's on the mind of Canadian and what do we need to think about as we're drafting new long-term care standards. Our next phase, basically from that survey and those results, our technical committee identified a few additional questions that we want to ask Canadians about. So for example, people were talking about, we want a home-like environment, but we wanted to know as a technical committee, what do you mean by home? When you talk about home, what does that feel like? Or what does that look like from the perspective of a resident, from the perspective of staff, from the perspective of family members, and other specific questions that came out that we felt we didn't get enough specific responses around, that we want to get more. And so HSO is, as a result, based on the results of the standards of the survey, has developed new consultation workbooks that have been released just the other week. And these can be completed by anyone interested in providing further input on improving the delivery of long-term care in Canada. So people can complete these as an individual. You can just get the actual workbook itself and complete it as an individual. Or, for example, if you want to facilitate a group discussion of any size. So we have some national organizations or groups at a home level that basically we have resident and family councils that are interested in running their own group discussion, and then they can complete a workbook as a group, or you can complete it as an individual. Heck, you can complete it as both. And so again, if you're interested in participating in this next phase of our consultation, then you can access and submit via via our website. And again, our website is longtermcarestandards.ca. And specifically to get to the workbook, you can get to, you just put /engage, and that's where you'll find it as well. We'll also be doing, we're also doing a series of town hall meetings. So these, for example, are the workbooks are the mechanism which through, there can be literally thousands of town halls that are facilitated at an individual or group level. But HSO will also be administering some broader town halls as well with targeted groups to make sure that we are making sure that we are getting the voices of certain groups so that we can delve into these questions in greater detail as well. So we're doing that as well. And then, as mentioned before, both CSA and HSO are required to go through what we call a public review. And so the first draft of the standards will be available for public input in January. And there's a public review period of 60 days from January to March, during which, again, anybody will be invited to read what we have, give us their detailed comments, and then we'll put that out. And the survey results that I shared with you today, those are going to be shared in a public-facing report that we will have out. I think it'll be ready via translation and processing with all the final results will be ready to be released in September. And then the results of the consultation workbooks and the town halls, that will be released during the public review sessions in January as well. So again, we'll be continuously reporting back so that those who are interested in seeing, again, what people were seeing will be able to see that articulated that way. We'll go to the next slide, and then Alex is going to talk about the CSA work that's underway.
Great, thank you very much, Samir. And again, thanks to your team for the great data that's also coming into the CSA group and our work as well. In addition to the HSO surveys and consultations, CSA is also engaging in enhanced opportunities as well. So, for example, we just launched actually back on August 11th a series of surveys as well, where we have various audiences that we're looking to gain information from. And you can see the three groups on this slide here, and perhaps the CSA team can post the links to these surveys in the chat window here as well. So again, we highly encourage everyone to please take the time and not only complete the surveys themselves, but distribute the surveys as well among your networks, as we are doing as well, because we want to make sure we try to get as many people as possible moving forward in terms of collecting data from these groups. Next slide, please. In addition to the surveys, very similar to HSO's work, we are also doing virtual in-person consultations as well, where we are going out and working with various partner organizations, such as AgeWell and others, in order to have discussions about specific questions that have come up, whether through the outcomes of the HSO survey or our previous consultations as well. And you see here a table with respect to the work that's been done thus far and the various groups that we are working with. We started off with a very broad multi-stakeholder broad outreach back in May. That allowed us to really get a good jumpstart with respect to where our standards should be going and what aspects we should be focusing on. We then also completed one with frontline workers, which was very informative to understand how our standards should be reflecting the safety of the frontline workers themselves as well, including family caregivers, obviously, who are a big part of providing that care. We completed one with the Indigenous community as well, where we had approximately 25 people in attendance. So it was a small group, but it was extremely informative. The information that we found out from our Indigenous leaders during that consultation was very invaluable and really just pointed to the need that yes, we're developing a national standard. However, that standard needs to have some flexibility built into it to take into account the local context, and that's just not geographical context, but also cultural and others as well. And so we learned some fascinating things there. And then we have an upcoming survey consultation as well with the LGBTQ2S plus community as well moving forward. Next slide, please. So as you can see here, these are some of the other audiences that we reached out to during these consultation with some host organizations. Again, I mentioned AgeWell. We had one last week where that Can Age led through Laura Tamlin Watts, again, which was very, very informative. We have one coming up for frontline workers, mainly French frontline workers, that Bruyere out of Ottawa will be leading for us. And then we also have one with operators through the Canadian Association for Long-Term Care, and actually that will now be held on August 25th. And so again, if any of you are interested in attending any of these upcoming consultations, just please let us know in the chat, and the CSA team will take note of that. Next slide, please. So I think we've already kind of talked a little bit about this timeline itself. So I won't go into detail, but maybe the one thing I'll add to the comments that Samir made on the timeline itself is this is very aggressive. Typically a standard out of CSA may take 4 to 5 years to go through the entire process with the review and everything else. However, we all understand that we need this standard now, not just the CSA one, but the HSO one as well, and hence why we've taken a very aggressive approach to it. And I'll just say that the teams at CSA and HSO have been outstanding in terms of keeping us to the schedule and moving us along. Next slide. So with that, I'll hand it back to Samir, who I think will then lead us into some Q&A and discussion.
Perfect. I think Alex will both be led in this discussion. So we're gonna tag Tanya and our teams at HEC, because I think there's been a ton of comments and questions coming in the chat. So I think we'll just be on deck to answer them as best as we can.
You're absolutely right, Samir. I've been copying every single question and comment coming in, trying to get to most of them as we get through this session. So I'll just start off right away with the first question we received, and it's directed towards Samir. So to put the COVID deaths in long-term care into perspective, do you know how many deaths due to natural causes have occurred during the same time period in long-term care? In BC, in the first 6 months of COVID, 151 residents died from COVID and 4,500 residents died from other natural causes in isolation, depressed, and feeling abandoned due to the well-meaning abuse of isolation and exclusion of loving caregivers.
It's an excellent question, and I don't have exact numbers, and I think we're still trying to figure all this out. I certainly, our National Institute on Aging has partnered with CIHI. The National Institute on Aging has been collecting all the reported information from provinces and territories related to what are being declared as COVID-related deaths in long-term care homes. But we certainly have been working in partnership with CIHI as well, and put out an initial report a few months ago, which really looked at the first wave and identified the fact that there were certainly higher than usual death rates that were occurring in our long-term care home that couldn't just be attributed to what we call COVID-related deaths. So we've noted that people could die of COVID or die with COVID or die of other reasons that weren't linked to COVID, but potentially because of the pandemic restrictions, the issues of loneliness and isolation, which we also demonstrated significantly increased for residents across the country, regardless of whether their homes were an outbreak or not. So there's still a lot of learning to be done, but certainly I think it's helping to inform us greatly about how there is the risk of COVID itself, but there's also been a real spotlight on the issues of loneliness, isolation, and what has been coined by French researchers as what we call the confinement syndrome as well, and the detrimental effects that can have.
Thank you for that. There's been also lots of questions and comments in the boxes around how will these be implemented, the standards. So the first question from Joanna Trimble is, please confirm that the LTC standards developed by HSO will be used for accreditation, which is a voluntary process. So if you can comment on that, and perhaps afterwards, Alex, you can comment on how the CSA standards will be implemented.
Yeah, so just starting off, so with the standards themselves, again, the standards are going to be standards, and so CSA and HSO are developing these new standards that will be available by the fall of next year. As I said before, standards can be used for anything. They can become the basis of legislation. They can become the basis of regulation. They can become the basis of accreditation. So right now, what we do know is that about 60% of Canada's long-term care homes, for example, are accredited by Accreditation Canada, for example. And Accreditation Canada actually uses the HSO standard as the basis for its accreditation. Now, about 80% of homes in Canada are accredited, and there are other accreditation organizations that use other standards that might be US-based or otherwise based, if you will. But Accreditation Canada, Leslie Thompson, who's the CEO of Accreditation Canada, said, Samir, whatever you come up with, whatever your committee comes up with from HSO, that new standard, that is for, Accreditation Canada will recognize that and implement that. To the question about are these standards voluntary or mandatory, for example, well, again, it all depends on what province or territory you live in. So, for example, Quebec actually mandates that 100% of its homes must participate in an accreditation process with Accreditation Canada, which uses the HSO standard. So we expect that as of the fall of next year, 100% of Quebec homes will be actually accrediting their activities against the new HSO standard. And there are provinces where it is mandatory. There are other provinces where accreditation is voluntary. But still, even in some provinces where it's voluntary, you have 100% of homes that are accrediting themselves then and there. So again, I'm not going to speculate on if these are going to be mandated or if they're voluntary in that way. But what Alex and I can commit is that there will be standards, and we're hoping there will be broad uptake. And the commitment from this government in its recent budget of $3 billion towards supporting the implementation of new standards will hopefully help to support their broader uptake. But Alex, do you want to comment on the role of the CSA standards and speculate, if you will?
Yeah, no, absolutely. And like Samir said, within the terms of CSA standards, they are not mandatory. They are not legislated for the most part. Ultimately, the hope is that this would become legislated as standards that we want all long-term care homes to be following in some way. Speculating, I don't see that happening anytime soon. And so really our job is to build a standard that really makes it tough for a long-term care home operator to say no to, because we want to develop these standards, as I said, with a very resident-based focus, but also with a long-term care home focus from an operator perspective. And so we've done a lot of consultations, obviously, across the country in trying to learn the nuances of the various provinces and territories that would be adopting these, and really trying to build that into it. At the same time, we've been talking to a lot of operators as well about how to implement these standards. And the final thing I'll say is probably one of the toughest things we need to deal with to ensure that the standards are implemented is that fine line between building a standard for future homes versus current homes. And we've already had operators reach out and say, well, we don't have the money to implement X, Y, or Z that's out of the standard. So what can we do? And so the way we're actually going to be writing our standard is including those options. So saying, ideally, this is the standard. This is what you should be doing. However, if you can't, here are other things that you can be doing within your existing home in order to come closer to what the standard itself is saying. And so again, providing that flexibility, providing that education will be really critical. And the one thing I should have mentioned before in terms of the consultation sessions is our consultation is not going to end just with the standard being written and released. We're going to continue to provide that education consultation after the fact to hopefully work with long-term care home operators, the provinces, the territories, so that they understand that it's actually not a big challenge to implement these standards themselves, but in fact, it can be done hopefully as seamless as possible, and that it will improve the quality of care for everyone in their residence.
Great. So the next question back to Samir is from Darla Matheson. Will there be consideration given to new models of long-term care from other jurisdictions, for example, culture change in the US or other person-directed care models in Scandinavia?
Yeah, so I think as one thing that I've said, and I think Alex has said as well, is that like everything's on the table. So what we have done as a first step is we've done both CSA and HSO have done broad jurisdictional reviews, looking at kind of what is some of the best evidence from around the world, what is some of the best evidence, from across Canada, for example, that can allow us to look at different aspects. And I think one of the key things is we don't want to necessarily get too broad or too specific. So we say that you shall do this or you shall do Y, for example. We don't want to get there because, again, we have to try and make these things feasible. So what we are trying to talk about is what are we aspiring to? And if there are two different models out there that one could say, yeah, whether you do the Scandinavian or this US model, for example, that ultimately will help you achieve the same aim, we want to leave that up to the homes, to figure out how they want to get to where we need to do. What we want the standards to do is be very clear on what we are aiming to achieve, and so that then folks can figure out how best to do that. And of course, you can have the best written standards in the world, but as Alex was just mentioning, for example, we just saw the story of what happened last week in Manitoba, where one of the oldest homes in downtown Winnipeg just announced that it's closing because it can't afford to do the renovations and redevelop itself to meet kind of current modern day standards after being built 60 years ago. And so this is where we don't want to necessarily start then losing capacity in our system, but we want to basically say this is where we need to get. And of course, ultimately at the end of the day, governments, who are obviously in charge of funding the provision of long-term care services, we need to show them, for example, what these standards are, and how they can help enable those standards being achieved. And that comes from not only funding for the development of proper care homes and facilities, but also making sure that it's not just, again, the hardware, but the software. When you're underfunding the provision of long-term care in a home, it's hard to staff a home adequately and provide excellent quality care. So those are things that we're not getting into funding, or those aspects, but those are going to be absolute enablers to creating, or to enabling the standards that both HSO and CSA are coming up with. Alex, did you have anything to add to that?
Oh, I think you've covered it appropriately. And again, it just goes back to that, the challenge that we've taken up to ensure that everyone sees the benefit in the work that we're doing.
We do have many other questions, which I will send to both of you after this presentation, but maybe we can just do one more before we wrap up. So I'll start with you, Alex. So we know that many provincial standards licensing requirements already exist, mostly for the regulated healthcare professions. So how would provinces, or is there a way for them to incorporate the new national standards into the current ones that already exist at that level?
Yeah, that's a great question. And one thing we are ensuring that we're doing is that we're not reinventing the wheel on anything here, that our standard is building upon many of the standards that already exist through CSA with respect to healthcare facilities and other aspects. And so we're building upon those. We're going to be including them, perhaps through referencing to those other standards. And so one of the tasks that we've really taken on is the education of our technical subcommittee in terms of what does exist out there with respect to existing ones. So again, that we can make that integration as seamless as possible.
And just building on Alex's point too, is one thing that both CSA and HSO have done is developed a government advisory table. So this is where we've partnered with kind of federal officials, but also provincial and territorial, ministries, if you will, involved in long-term care, to invite them to be a part of the process as well, so that we can exchange information, so that there are going to be no surprises, and we can actually have the input of several provinces and territories, and federal government jurisdictions that have a say in this work too. So we're certainly kind of making sure that what we are doing is complementary and is enabling, as opposed to competing and disruptive.
That's great. So thank you to both for providing an overview of what you found to date and where you are in the process. We have many other questions and comments which we will send your way, and we'll make sure that we share those back with our participants today, along with the recording of the slides. Many of you have been asking for the slides from the presentation. So thank you, Samir and Alex. So just for everybody that all teams enrolled in our Long-Term Care Plus program, we are hosting on September 2nd a town hall with HSO and this is a special event. So many of you have already pre-registered for our huddles, but you will have to register for this one separately as it will not be part of the existing calendar. So please make sure that you register for that town hall as the HSO is collecting some feedback. Again, in alignment with the new national standards. Also, we appreciate your feedback today on today's session, so please fill out our poll. Also, just a reminder that our next huddle is the town hall, which will be on September 2nd, and it will be for an hour and a half, not our usual 30 minutes, and it will be led by HSO and the National Long-Term Care Standards consultation process. And our next webinar, so virtual learning series, is on September 13th. Where we'll be presenting the Wellness Together Canada, a mental health portal for everyone across Canada. So thank you very much. Thank you, Alex. Thank you, Samir, for presenting today on the national standards. There's lots of interest, and people are actually also looking forward to hearing from you in terms of frequent updates on the process. So we look forward to engaging you in a conversation later on.
Great. Thank you very much.
Take care, everyone.
Thank you.
Bye-bye, everyone.